anything that you can think of, like when you run into issues, it's always good to have a financial advisor. So we're always there for our clients. And again, thank you so much, guys, for opening the doors for us for the last couple of years. And thank you, guys.
And shameless plug here, JP Morgan does organize many conferences, including the healthcare conference that's typically early January here in San Francisco. They have another one that happens now in April in Nashville. Our portfolio companies on the healthcare side have gotten great results out of these conferences, many customers. We ourselves also host a big event. So if you want to hear more about our events, we do a lot of these. You can sign up on our newsletter. Quick word here about this location. You are in a historic location. The mouse was invented here. Ethernet was invented here. If you want to find out more, there's a beautiful museum here at the entrance. You can take a quick peek once we go out for the networking side. And I wanted to thank SRI for a long-standing partnership. This is, I think, the 6th event we have done with them, 3rd time we are doing our annual event at this location. So thank you to all of you at SRI, especially Todd and Stacy. Wanted to do a quick intro on Tao. So we have some slides coming up. Awesome. So here is the team. You have almost everyone here today. We have 3 venture partners. Actually, just show of hands to our 2 venture partners that are here today, Larry and Ravi. Thank you. Larry, where did you go? He might be outside getting a drink of water. And Balaji, if you could also, Balaji, we're working out exactly, but he's also working closely with us. And we do have a venture partner in Singapore. Singapore has been a great location for us to help our portfolio companies expand into Asia. We can talk more about this later, and obviously we'll have chance outside to go into depth. But this is a little bit more about the extended team, and the extended team is crucial to us. This is a snapshot of our advisors. We didn't put our LPs here just to protect a bit their privacy, but we have hundreds of thousands of followers at this point. We just announced Fund 3. Hopefully most of you saw this. Proud to say that we have had more than 200,000 views on that post alone on LinkedIn. And this is not a vanity metric. We're not in this game for vanity. We're in this game to help our portfolio companies. So the more followers we can have, the more meaningful connections we can have, the more customers we can bring to our founders, the more investors we can bring to our founders, the more business we can bring to them. We have 5,000 VCs on our mailing list as an example. So all of this, once again, is to help our portfolio. Sanjay, let me pass to you.
Yeah, sure. And a quick introduction. I'm Sanjay Rao, one of the co-founders, and let me just give it to the mic.
Hi, everyone. My name is Insu. I work with Sanjay in the enterprise side. Let me pass it to Sam.
And hey, everyone, if you can hear me. My name is Sam Bogrove. Similar to Insu, I'm a principal, but I work mostly with Amit on the healthcare side.
And as you know, we invest across digital health, enterprise, and the physical AI world as well. So we've actually, now that we have Fund 1 and Fund 2, we have some great data. According to Carta's metrics, we're a top decile fund. Our portfolio companies have gone on to raise $6 billion worth of capital outside, and we've had over 10 exits already. These are some of the companies that have been acquired already, and we've got many deals that are above 10x in terms of our multiple already.
Yeah, and you're going to hear a lot about some of our winners today within our panels, but this is our timeline. So, we started off in 2020, and it's been a crazy journey. It's been a 6-year journey, but as Amit and Sanjay have alluded to, we have been top decile fund for both Fund 1 and Fund 2, and now we're doing our Fund 3, similar thesis, but just bigger checks and just really honing in on helping our founders become more exceptional than they are. Let me pass it back to Amit.
So as we chatted earlier, we will start with our keynote, followed by the enterprise panel and the healthcare panel. This part of the event is being recorded, so if you guys want to watch it later, we'll post it on all of our channels, including our website. We'll send it out through our newsletter. If you want to be more involved with Tao, if you're not already, the newsletter is a great way to get started. You can sign up on our website. You can follow us on LinkedIn. If you have a great founder that could be a fit for us, send us the deck or tell them to figure out a way to connect with us. We do read every single message that reaches us. We can't respond to everyone, just given the sheer number of messages. Quick data point, the Fund 3 launch gave me 700 messages in one day. So we do try to do the best we can. If you don't hear from us, it's as a founder, it's because we probably can't do justice to you. We hear 6,000 pitches a year. But on that note, let's introduce our keynote.
Super to have Ray, who just flew in actually from a board meeting. You can talk about Ray Lena, who's kind of an institution in the Valley. I think many of you probably know Ray. But Insu or Sam, you want to give a quick background?
Yeah, quick background, Randy is a technology executive and venture capitalist, best known for leading the turnaround at Oracle Corporation in the 1990s. As Oracle's president and COO, Ray reestablished the company's leadership in the database market and grew Oracle's market cap by 65x to over $200 billion.
Thank you, Ray, for coming, and we're excited to do a fireside chat. Let's do it.
Where do you want to sit?
Wherever you want, there,
Great.
and the two of us can sit here.
Okay.
Yeah.
I know this one's working, so I'm gonna do.
Okay.
Well, so Ray, thanks a lot for making time for us. We've known each other for some time and co-invested as well, and many of us in the room have known of you for a long time now. And this is a very interesting time right now with what's happening with AI, but in some ways it's similar to all the other things we've seen before. So we'd love to delve into that, but maybe we could start out with just sharing a little bit about your background and the perspectives on moving from operations and then into venture capital as well.
Well, thanks. Is it on? Okay, you can hear me? Well, thanks for inviting me. I'm really thrilled to be here. I haven't been in this building for a very, very long time. Maybe the last meeting I had here was with John Silly Brown, which kind of dates me. I think it's safe to say that every technology invented in this building might have post-dated my birth. So, I've been in this industry a long, long time. I've been very, very fortunate to work for some great, great franchises in their time. So I started my career with IBM and spent 8 years at the time IBM was breaking out. It was like joining Google in 1998 or maybe a little later than that. And so just a great time, great place to get started. I was then recruited by Ross Perot to EDS. How many of you know who Ross Perot is? Yeah. He took the IBM out of me. He gave me a business to run that he had never invested his own money in a business. He had always done it on customer funding. So there was no such thing as venture capital back then. Probably was, but he wouldn't think of using it. So he basically started on a customer contract. But he decided he wanted to take services he was providing in the market to non-regulated industries. So get out of the government stuff, get out of the Medicare stuff, and try manufacturing, distribution, transportation, and retail. And so I had a chance to, at 30 years old, to run a business, and it was a great, great opportunity. I then went to Booz Allen Hamilton and started as a partner there to build a business locally, but ended up running the IT business, the technology business worldwide. And there is where Oracle found me in 1992. I hadn't watched Oracle very much, even though I was responsible for consulting to some of the biggest companies in the world on technology. Oracle was pretty low on the totem pole in terms of the IT stack. And we didn't get called on a lot to talk about database technology. So I didn't know a lot about Oracle when I got the call to say, we need somebody to lead a turnaround. Oracle had hit the wall in 1991. They went public in 1986. They doubled every year. Everything was going well. They pivoted from their database software sitting on HP 3000s and PDP decks, DEC PDPs, to get away from the mainframe and start departmental computing applications, to moving now into much larger servers and much larger businesses and competing directly with the data center. And it interested me, especially after I met Larry. So I went out thinking I could, if the worst that could happen is I could sell him a consulting assignment, right? And I could basically bring Booz Allen into Oracle. And we spent 4 or 5 hours together and just never stopped talking. He wouldn't stop talking, I wouldn't stop talking. We just kind of hit it off. And all the way back, I lived in Dallas at the time, all the way back to Dallas, I said, you know, if we could take this business, turn it around really fast, and then build an application business on top of it and a consulting business on top of that, this could be really, really big. And I think that was my ego talking. I don't have a big ego, I don't think. And most people tell me I don't, but I think on the plane, I was just thinking, okay, I think I can do this. Everybody told me I couldn't. So my friends, my clients at Booz Allen, my wife, everybody said, don't do this. I've read about Larry Ellison, and this is not a good thing to do, to leave what could probably in the next 5 years become a CEO position with Booz Allen Hamilton, very respected consulting business. Something in my gut just told me this is possible. And it was a great 8 or 9 years where Oracle's market cap was probably $2 billion when I came in 92, and we ended up somewhere around $220 billion. I went on to Kleiner Perkins, remarried, had 2 small kids, and so I was very interested in having a job that didn't fly me around the world. When you leave, top of the game at a company like Oracle, you get a lot of offers to be CEO of this, CEO of that. All of them were going to be 7 days a week, 24 hours a day, traveling around the world. I really wanted to be home with the kids, and the Kleiner guy said, why don't you come over and just spend some time with us? I really didn't like venture capital at all because what venture capital meant to me is they would steal employees at Oracle, and promise everybody with a boatload of stock options that you can become rich in 2 years if you just go to this startup. And I don't know how many times I had meetings with employees saying, okay, I reserve the right to say I told you so. And so, of course, I did not know the thing would blow up in 2000, but a lot of those employees came back. And so very fortunate to land and really take 3 years to understand the venture capital business from the best, from really good people that have been there a long time, like Binod and John Doerr and just really people that understood the business. So I learned it inside out and stayed with it. Stayed 14 years at Kleiner and then started my own firm, GreatPoint Ventures, 10 years ago. I'm really close to retirement now. I'm really working hard on it, but I'm still on 10 boards and doing new companies. But someday I'll get serious about it. So that's the career. Very fortunate. If you look at that career, I mean, it was not planned. My plan was to be CEO of IBM when I was 21 years old. That was my plan. And so you can't plan these things. And what I got was to work with great entrepreneurs like Larry and Ross Perot and some other people you probably don't know, and a mix of product, sales, services, by the best. EDS was one of the best services business on the planet. Booz Allen was one of the best consulting companies on the planet. So I got that. And if I could have planned it back 40, 50 years ago, I could have scripted it this way and say, what do you want to know coming into the venture capital business? What will be most helpful to entrepreneurs? I couldn't have scripted it better to get a real education in all these things. So that's the career, and I thought you might ask, what did you learn over that time frame? And I'm happy to. I wrote down on the plane coming in. I wrote down like 9 things. Nobody does 9 things, so I've added a 10th. So I'm happy to go through some of those if you'd like to go through that, because it might be That'd be helpful. Just things that I think I don't read about. They just kind of are kind of how I think about business. So number one is, the more I've seen many technology waves. So from mainframe to mini, you always see this, the first slide for everybody does this slide, technologies move through all these phases. Well, I've seen them all up close. I started at IBM in a class where I had to wire boards. You know what I mean by that? Does anybody know what I mean? Wiring boards and accounting machines. Quickly, thank God, it moved to programming and COBOL on mainframes. But the technology, of course, changes, and I won't go through all that because you ought to all know that and how wonderfully productive our industry has been. But the more technology changes, the more that leadership and running a business stays the same. I have not seen that change in my long career about how you recruit, lead people, build technology, scale companies. It pretty much is the same. And I know a lot of people that are young today that are starting out would say, yeah, but it's a lot faster today when you did it, old man. No, it's not. The technology certainly is changing faster, and how you have to react to it is faster. But I've also seen a lot of technical people who make the mistake of, I build it, they will come, we will reap the rewards, and it'll be all over in a year. It'll be done. It's going to move that fast because they can see the trillions that are created and the trillions that were, destroyed. What do we destroy today? Like $700 billion were destroyed in the market today by 7 companies. Okay, so it's not for the faint of heart, but so number one, tech changes, but leadership and company building, they're immutable. They're just immutable. They work the same. Second is leading from the coalface. I don't think you can be an entrepreneur that develops technology and says, builds all the features and knows you have a very competitive product, and then wait to hear the feedback from your sales force. And don't go and sit between that interface between your product and the customer and really understand and really get very candid about how the two interface. Third is be company builders. Don't just be entrepreneurs or investors if there are investors in the room. We started GPV for one reason. We had noticed that the venture capital industry had become younger and less experienced. So a lot of people were going directly into venture capital and say, I'm 30, 32 years old. I did one company. I was head of marketing in this startup. I can be a venture capitalist. And so what is the experience you're bringing into the room to help build a company? Well, it's not. It's basically using formulas that are handed down to kind of say, this is my advice. You want to hire a new head of sales? I know a recruiter we can call and put him in here. And so it's not real experiential help, either in functions or in industries. And so we started GPV based with company builders. Everybody was a CEO or a president of a company or a serial entrepreneur that built, like Andrew, my partner, has built 9 companies. So we just said that is needed in the market. And I think it's actually swung back. I think that venture capital companies, firms are providing more experience and more help now. Be a multiplier. I've seen so many entrepreneurs that basically I know the hole I'm trying to fill. I know the product I'm trying to build. I'm going to hire these people. And if they are not working out, I'm going to basically bring them in my office and tell them what to do and say, go faster, go jump higher. And so you're not scaling by doing that. You're not multiplying by doing that. And if you think about it as hire the best people you can, hire really, really smart people, smarter than you, and then ask them questions, probing questions, so that when they come into your office and they say, I'm responding to how we build something or how we sell something, or you say, look, let me ask you a number of questions. And they go out of your office thinking, how can I do better to please you? How can I, and if that falls through your company, if each manager thinks about it that way, but there are so many managers that basically are really, really smart. And there's, I'm sorry, I forget to put this up. And they're really, really smart. They'll be what I call diminishers. And you go out saying, yes, I screwed up. I really fucked up, you know, so. Culture is who you, it's not a plaque on a wall. It's not like we're good guys. You know, we love you. It is who you hire, who you promote, who you fire, especially who you fire. When you, the CEO, or you, the founder of a company, fire somebody, it should be a public hanging. It should be, this is what we don't want. For some reason, that person was asked to leave. And I know it's HR, there's a lot of, you know, very delicate, you know, processes today, but you lose a real opportunity in saying, okay, the CEO sets the culture and you set it by hiring, promoting, and firing. And people will get it. You know, there was a culture at Oracle. Even there were no signs, there were nothing written down. You could not read the 6 platitudes of the culture, but I knew what it was. Win at any cost. Win at any cost. The people were the best in the field, the best people you could find in sales and development and marketing and support, but they wouldn't work with each other. The knives were out every day. So I said, okay, we're going to change that culture to one of working as a team, learning how to work as a team. And if you want to stab somebody, stab them in the front, don't stab them in the back. Don't try to boil the ocean. Many companies start out saying, I'm just going to, you know, I'm going to be Google. I'm going to be, you know, this, especially in this new AI world, I think the focus is going to be on doing something very, very specific. You know, tailor these trained models and the new smaller models that around the business processes and exactly what the company wants to deliver something that's almost an appliance, if you will. It's software, but it's an appliance because you're changing the behavior of the company with these new tools and new software, with these new models. You're changing behavior. In the 90s, we weren't changing behavior. We were simply trying to make it more efficient and build around the business processes. Define the problem. I see a lot of, you say 6,000 pitches a year. I think we probably see the same number, maybe more. And most of them are great ideas. I saw one bad idea, truly bad idea in 25 years, truly, you know, it was something about hauling, they were going to generate electricity by hauling water up a hill and then have the water come down or something. It was like written on the back of a paper bag or something. I mean, but most ideas are really good by the time they're being considered by a venture firm. They're really good. So how do the ones that get funded? And yeah, there's a lot of capital out there and most companies do get funded. That's not a healthy thing, by the way. That everybody gets funded is not a healthy thing because it tends to create a lot of weak competition. And that's not good for the really good players. And so I've always argued since I've joined venture capital that the industry should shrink. When I joined Kleiner, there was 1,000 venture firms. How many are there now? Anybody know? How many? 3,500. The industry should shrink because it just, you know, it's funding a lot of stuff out there, and we know the math, right? The top 10 and 15%, 20 at best, venture firms make all the profit in the industry. And in every fund, there's 10 or 15% of the companies are the game changers. Now, it didn't say that there's another 50% that can make money, but the game changers so the odds are really against. And so by definition, the venture industry is funding a lot of weak sisters. And you may feel like, you know, if you're one of those weak sisters, that you're not a weak sister, and the venture firm funded you, so how could you be a weak sister? And maybe you actually manage your way to be a really strong player in the industry, but the odds, you just can't, the odds have been this for 50 years in the venture business. Okay, so we're playing roulette, trying to find the best companies to invest in, trying to help those companies out. But at the end of the day, the real game changers, it's a small number. And so define the problem, really define, spend 80% of your time, 80% of your time defining a problem that you're trying to solve. Don't be, okay, I see an opportunity by a hole in this domain. I see something that's not getting done that could be done with better tools, better technology. So I'm going to go plug that hole. That's my company. That's maybe not totally thought through. Think it through. It's 80%. In other words, you get to the point, you spend so much time on defining the problem that the answer falls out of that. You don't have to spend any time on the answer, the solution. It just falls out. I know I'm going to have demand. I know I'm going to have scale. I know I'm going to have, it's all that's going to be there. So hire for resumes, or don't hire for resumes. Don't just pick the best resume. Hire for energy and ownership. Somebody that really wants to own the problem and has the passion to solve the problem, not just that they have a great resume. So hire for that attitude, ownership, somebody that has as much of that as you have. The one I threw in is reward, risk, candor, and speed. So anyway, that's our opening. We out of time?
I had a list of 10 questions also, but I'll ask one.
Okay.
You talked about VC a fair bit
Yeah.
in your insights right now. At least the way I look at it, we're at the 4th generation of venture capital. Depends on how you divide it, but this is the 4th moment. I've lived through the 3rd and the 4th. I've been doing this for less time than you, but I've been doing it for 16 years. What I'm seeing is that there's more and more money, as you said. There's more and more money in the market. Companies can stay private longer and longer. Exits are taking longer and longer unless you do a secondary. What used to be 10 years is now more like 12 years, maybe even 15 years. Funds are also getting bigger and bigger. On average, there's a lot more funds. The economics are changing. What used to be a seed round with 25, 30% dilution is now 10 to 15%. What used to be, when I was a founder, a 5 million Series A, these days is called a pre-seed.
Right.
So I was wondering, how do you see all of this coming together? Are we headed for a crash? Are we headed for a utopia? Are we headed for something unknown? Like, what are the tea leaves saying?
I'll go back to the historical numbers, and I think it's really hard to fight history, is that there are going to be winners and losers, a lot more losers than winners, okay? And we all know that in the venture capital business. Now, good venture capitalists, and most of you know this, are pattern matchers, okay? So they use historical trends, their experience, looking for large TAMs, looking for capital efficiency, looking for great teams, a technology that has great IP. Those are the patterns they're looking for. And I'll talk to the entrepreneurs. You as entrepreneurs, when you go into a great branded venture firm, you feel, wow, I'm in hallowed ground. I walked into Sequoia, or I walked into Kleiner, I walked into Andreessen. I'm on hallowed ground, and you think, oh, this is where I want to get that commodity called cash. Okay, cash is, no matter where you get the cash, it's the same cash. Okay, it comes from, now, assuming that venture firm stands behind you, that they stick with you. Be careful, because you as an entrepreneur, I'd say 80, 90% of entrepreneurs I know are not happy with their boards. So if they could create a board, they would design it to be, I need a great technologist, I need somebody with experience in sales, I need somebody with experience in government if I sell to the government. And what they have is at least 3 venture capitalists who all have answers, who all have ways of doing, including me, who have ways of doing things, okay? And you say, well, okay, well, if somebody's willing to roll up their sleeves and help me, really help me, but I think the great operators that go into venture capital are not the great venture capitalists. The great venture capitalists are the true pattern matchers, the triagers, the people that can really, work for an outcome at the venture firm and know the numbers game. I've got to invest in 10 to find 2 or 3. Okay, and those are very good venture capitalists, but they may not be the best to be a board member of your company. So once the investment decision is made, you have a board member. Love that board member. Rationalize why that person is the right person to be on your board, because that's what you're doing. You're building. If you're in this to build a sustainable company, whether you're going to sell it or not, you're in it for 5, you're in it for 7, you're in it for 12. That board matters. So build the board. And you might want to take capital from, when you say, okay, if I can get this board member, I've had very few entrepreneurs negotiate hard for things that they should negotiate for. Okay, I've worked for 2 months with this associate. I really love him. And so the partner that is going to sponsor the deal, maybe that's the partner is going to go on my board. But this person really has functional skills. Can I get that? That person is the partner on my company. And so it's, it's hard. I mean, you're shopping for cash, you're shopping for capital. And so, you want to get it at the best place. But once you do it, now you have a company to run, and you better have a good board member out of it. So somebody to work with.
And that's great. And sometimes we see companies with boards at the seed level, and sometimes we don't. Not sure if you have an opinion on that. But one other
No, not at the seed level.
Yeah.
He's board and advisor is the same.
Yeah.
Same thing.
And because it keeps things efficient as
Yeah.
well.
Yeah.
And one of the things that's happening right now is foundational models are doing more and more every day. New models are coming out. The software industry has been there for decades. There was a pullback recently, and then it kind of rallied back. What do you think about the prospects for software versus AI models? Any thoughts around a durable strategy for a startup to navigate what is in the roadmap of a model, or being a partner to the model?
Well, in the 90s, when the internet, kind of the end of the 90s, and the internet came along, and startups were plenty, and companies that already existed were changing their model. I know we tried to pivot on a dime to put our applications at Oracle on the internet. Let's be the first ones out there with a thin client. So you run them basically on the server. And so we're trying to turn it inside out. But that basically was to deliver access and distribution to the world. Let the world access information easily on phones or laptops or whatever. This is a very different, feels the same, that it's moving so fast. We all worry, investors really worry, that there's a crash coming with all the capital being invested. Look at some of the earnings yesterday. Google's earnings, did they deserve to lose ground in their stock price today with those kind of earnings? But it's all about the amount of capital that they're investing. And that seems to be what investors are most interested in today. And so, but the difference this time is that the technology that you all are developing changes behavior in the company. It's not about access to information as much as it is changing the behavior. Some agentic software takes over a business process. I can get answers right away. I don't have to kind of rely on an application that is going to run a process and populate a database to get my answers. And so it's a very different game. And that's why I mentioned earlier, I said the training is nearly over. I mean, they'll continue to train these models, but the money to be made in training is over. And the next 5 years is about inference. It's going to be about inference. And the more inference can be around a horizontal process, a vertical process, that you can have agentic technology replace that process, almost an appliance, I think the more attractive you're going to be. So if you go into a hospital or go into a medical system, you go into UPMC and you're selling, I'm here to tell you about what I've done in 2 other places. I've lifted this process out and I replaced it with this. The more you do that in the next 5 years, I think the more successful you're going to be.
We wanted to give the audience opportunity to ask a couple of questions.
Inference is the next big thing. Why do you say that? I mean,
Well, training will last forever, but I mean, the amount of capital that has gone into some of these frontier models and to build those, we're seeing now they're most interested in training at the edge, basically to get original voice data, original video data, just hoover up everything they can hoover up. But these are very competent models today. But they'll continue to train. But can you go into one of these frontier models or go into the enterprise today and sell something for training a model? I think it's hard to do. Right. I think you'll start to see it late next year, mid to late next year.
Back here. So thank you so much for your insights and flying all the way. I really appreciate it. I had a question about hiring in today's age. There's a lot of people who are delegating a lot of their thinking to AI. And it's also very important for employees to team with AI to be productive. So how have you seen best-in-class entrepreneurs, founders hire effectively for good teaming as well as good thinking? Like any tips you can share would be awesome.
So, I'll steal a line from Jensen. He was a keynote speaker at Carnegie Mellon. I'm on the board at Carnegie Mellon this year, and he said, he's speaking to the class, the graduating class, and said, you all should not be afraid of AI taking your jobs. You should be afraid of people that know and understand AI taking your jobs. So AI is not fearful. Now you're talking about people who are, 5 years ago would be called cheaters. Okay, I'm using AI to do my job. Today, they're smart. I would call them smart. So teaching them how to use, I used to use the slide rule. Okay, and I had people telling me in my well, the slide rule will never go away, but this calculator does everything. HP 12C does everything that slide rule does. Never go away. So learning how to use the tool and doing what a human being can do to use the tool those are the type of people you want. That they can now maybe they understand a process, or they understand and I don't know if you're talking about developers or you're talking about people in functions but people that understand their function and are very open to changing that with good ideas that then can be wrapped around the company's internal business processes. So I think it's at a time where we're not going back. Having people that are very skilled in AI and use it and don't feel ashamed or embarrassed or going to pay, oh, you used AI on this. Well, it's not a bad thing.
With that, I think let's thank Ray. Thank you so much for sharing your wisdom. And we look forward to doing more together. And we've got some fancy Tao glasses, wine glasses for you as well to add to your collection.
Great. I should mention our firm is an LP in Tao.
Yes. Thank you. Thank you.
Awesome. Well, next up, we're going to continue with the enterprise topics here, and then we're going to move on to healthcare, and then there's food after that. But I'd like to invite up our next set of panelists. These are all founders that Tao is invested in. We've got a great group here, different stages. So Ashutosh, Brandon, Justin, Manu, Sridhar and Ani, come on down. Hopefully you can line up with your pictures. So just in the interest of time, Justin, you've got that. I'll stand. You know what? I'll stand. In the interest of time, let's just do very quick introductions on what stage your name, and stage of your company, and a little bit like a 15-second snippet so we can go through some other questions.
Thank you for inviting and thank you for investing. I'm Ashutosh Garg. I'm the CEO, co-founder at Viven.ai, where we are building digital twins of employees and individuals, both for consumers and enterprises.
Hi, everybody. My name is Justin Seeley. I'm the CEO, co-founder of Nidus Technologies. We do physical AI and manufacturing infrastructure for the defense industrial base.
Everyone, Brandon Shee, co-founder and CEO of Crop Diagnostics. We're building the genomic data layer for agriculture by helping farmers, input companies, and breeders make better decisions.
Hello, my name is Manu. I'm founder and CEO at Labelbox. We produce reinforcement learning environments that is powering a lot of these AI frontier models, as well as we have an enterprise product for agents powered by open source, also allowing them to do post-training with reinforcement learning.
Thanks. Hi, I'm Sridhar Iyengar, and we're building AI-powered IoT systems for highly regulated industries like biotech and pharma to make their compliance and their operations more efficient.
Awesome. And all of you have raised at different levels, but one thing that's unique is, or the same, is you're all using AI and deeply creating your own models and also leveraging some of the foundational models or training them. Can you talk a little bit about what the proprietary model of your company looks like, what the data flow is, and what part is, how do you maintain the privacy or your proprietary IP around your model?
So privacy is at the heart of everything. The simplest way to think about what we are doing is, if you take any two individuals with exactly the same knowledge and experiences, they will still do things differently. And what makes them different is what we are all about. How do you really understand the reasoning, thinking, logic of each person, combine it with their knowledge so that now AI can start at least helping people do much better by really understanding them, making them a lot more accessible and a lot more available. So that is what we are doing. One big shift on the, especially you mentioned the privacy and security that we are seeing is, for the last 15 years, 20 years, right, everything was moving to cloud, SaaS was hot, all kind of things. Now there's this big movement towards on-prem back. So in my previous company, it was all about let's build everything on cloud, and we are serving it in a SaaS setup. Now everything is virtual private cloud, on-prem, deployed on their own premises. So that's a big shift.
And do you create a model of, are you creating models of each person in the organization and how they'd operate?
Effectively, yes, but not in a traditional sense of LLMs the way we have thought about it, because that becomes cost prohibitive, very expensive, and almost unmanageable. I think the jury is still out where the world will unfold, whether we will go, everyone will have their own personal model or not, or there will be a representation of their data, their understanding, their reasoning, which can do 90% of the things in a much more cost-effective fashion. The other big challenge also that comes with building truly the model, especially in the world that we are in, is the hallucination. Then it's very hard to explain certain things that model does. So the path that we are taken is a combination of some reinforcement learning fine-tuning, but also being able to encode the user's intelligence in a unique fashion.
Awesome. And one more question on you. How close are we to being fully automated in which functions in the enterprise today?
I would say they said a very interesting thing, right? Is AI going to take over your job or not? Or people who use AI will take over your job? I think the better way to say is that what task that I do today will be taken over by AI. My prioritization of inbox, taken over by AI. My writing the emails, my writing the blogs, all taken over by AI. Actually, one thing that I would challenge is that 80% of the creative work that I have done over the years is taken over by AI. AI has become my best, most impactful strategic advisor taken over by AI. But wherever it requires human trust, human judgment, and human accountability, I think sits with human.
Awesome. And maybe Mani, you could give us insight into, I mean, what is the AI gyms right now? What are the AI factories look like? Because so much of the training and inference is actually happening with your platform.
Yeah, totally. So the way, to ground everybody, basically like let's say the frontier model, Anthropic or OpenAI, any of these frontier models, they're spending 70 up to 75% of their total training budget on post-training. Just about 2 years ago or so, most of the compute cycle, the flops going into training these models used to be pre-training. But now it is actually post-training. And the question then is like, well, what happens in post-training? Well, the kind of the way these models are learning about knowledge work is that they have to learn by trial and error. And these, what we call reinforcement learning environments, are essentially a simulation of knowledge work. An example would be, let's say you have in finance, you know, many knowledge workers would look at all the SEC filings and come up with the LBO model, or any kind of a finance model, or update with some new information and things like that. And you're seeing that these models can do like, you know, 60, 75, 80% of the work fairly accurately. The way the environment is, where in an environment where there will be all the data set or database or tools, and there will be an example of these models that they, you know, the AI has to make, and it gets verified, like how effectively the AI did that job. And so these are the kind of environments. Some of the other kind of more complex environments are actual business applications. So like every business has Slack and you know, CRM, SDLC lifecycle with GitLab, GitHub, and so forth. So an environment would be essentially entire Docker container that has maybe in a clone or open source version of these apps with real data, and the tasks are emulating what, you know, knowledge workers would do. Like I have an outage, I've got to have software engineers figure out, debug the situation, file an incident report, and maybe communicate back to the customers. So now agents are learning to do that across that entire stack. And so that's what we do in a big way for Frontier AI Labs. What's really interesting is that in the enterprise, the way enterprises are going after building models that are proprietary to them are based on mostly open source models. And these environments for them are very unique and narrow to their business workflow. But the process is the same. The agent has to go inside this simulated environment and just kind of learn by trial and error. Very similar. The analogy I use is like, it's very similar to simulation software and engineering. Whenever you're building some new chip, or let's say self-driving car, you're simulating how your systems can perform in all those scenarios and so forth. And these environments are like that. And that is basically the state of the art. That is kind of like how we know these LLMs are learning on a daily basis. Yeah.
Can you talk a little bit about the scale of what you're seeing at the foundational model companies in terms of how deep and complex the actions are of an agent that your evals track?
Yeah, I mean, these models are, I mean, insanely good, and like we have access to unreleased models, like usually like 3-4 months before they are public, and in order to produce an environment like a reinforcement learning environment for, let's say, any kind of domain, whether it's cross domain, whether it's finance and so forth, they are extremely, extremely tough to produce. They can cost anywhere from $10,000 to $100,000 a single environment. And in order to do large scale training runs, these companies have to deploy, like to run the training cluster on hundreds and thousands of these training gyms. And so that's kind of like the scale of what it takes to build, let's say, frontier model today. And that's kind of the reason why labs are spending billions of dollars per year right now in reinforcement learning environments. And it seems to be only going up for now. And but it doesn't have to be like that for, let's say, an enterprise use case, because the enterprise use cases are extremely narrow. What we're starting to see now is a 35 billion parameter model post-train on that unique workflow can beat or match or beat a frontier model. And so the token cost for that workflow would be somewhere between 5 to 10x cheaper, because it's post-trained. The intelligence is spiky, so you can really spike that intelligence in one area, and which is kind of like what you're seeing the boom for a lot of the open source led stack across the enterprise. That's one of the reasons Satya has been saying, enterprises are with this kind of stack and architecture, they can retain their IP and have this learning loop where they're constantly revising their harness, context, and the LLM based on their workflow, and it's getting better over time.
Yeah. And well, actually, let's on that note of proprietary models, Justin, Brandon, and Sridhar, you guys are deeply dealing with very proprietary data because you're in factory floors and probably uniquely positioned to capture an entire set of data, which isn't easy to access unless they're really on the factory floor. Can you talk a little bit about your own data capture and how you're maintaining your models?
Yeah, sure. So 95+% of our customers are all biotech and pharma. And what I love about this industry is that they are slow to adopt new technologies, which means that we're not coming in to displace an incumbent, but we're actually coming in and really displacing, I guess, human inertia or lack thereof. And what that means is that we have kind of a greenfield opportunity to come in and collect data that's never been collected before. And to your point, a lot of biotech and pharma is, because it's highly regulated, we still see Windows 95 machines connected up. And I kid you not, it's because once it's been validated and documented, you don't change it. And so we come in and we say, okay, we go to our clients and we say, you're running our operations on spreadsheets and thumb drives. And we can automate a lot of this, but you're actually missing out on a huge amount of data that you're not even collecting. And what we do is we actually have physical hardware, IoT devices that we actually plug into machines, pull data that's never been collected before, and then we merge that with their existing data sources. So a large part of what we do is we're picking up operational data, operational behavioral data of how these companies actually operate. So think smart labs, smart factories, smart clinics. There's a ton of information, simple things like how often is a machine used, and should we do preventative maintenance on something? If something goes down in a factory, then you've lost production, you've lost revenue. And so if you're not even collecting certain bits of information, that's not even going into the models. So the larger what we do is we pull that data that's never been collected before.
And Brandon, you guys also have a proprietary loop for collecting probably data that's very rarely been seen before.
So for context, we do genomic sequencing on plants. So literally farmers, agronomists, ag retailers throughout the country right now in 39 states are sending us leaf samples for our lab. Our lab's processing 2,000 samples per week right now. We're operating at full capacity. And so our moat is the data that's really hard to collect. So I think there's kind of three pieces to it. The harder the data is to collect, I think the bigger the moat you have. The harder that data is to interpret, I think the bigger moat that you have. So for us, when we sequence a leaf disc from a given crop, like corn, that's 39,000 genes turning on and off or differentially expressed, right, to make up the transcriptome of that plant. And we use machine learning and AI to mine through those 39,000 differentially expressed genes to figure out what that plant is trying to tell us. What is it signaling? Is it signaling that it's on path to hit this yield, right? Or is the plant signaling that it has a certain nutrient deficiency and it needs more fertilizer, or doesn't need fertilizer, or it needs certain pesticide because it's facing a particular disease? And so dissecting that data and figuring out and analyzing it is another part of our moat, and we have our own proprietary models to do that analysis. So yeah, for us, our moat is entirely based on our proprietary data set that, Anthropic and OpenAI don't have access to, right? And so that for us is our major moat.
And Justin, you're reinventing American manufacturing. I'll put it broadly. But again, you're dealing with a lot of data and physical items that you're the only person capturing that data.
Yeah, I think for for the defense industrial base, the barrier to entry is often the IT department, and then DISA, the security agency that basically says yes or no to any IT infrastructure across the government. I think what we've seen is being willing to give solving a problem for a customer and then making it their victory is a way better way to do business than to say I'm here to save them. And we've noticed this recently in the manufacturing space where for a lot of people, there's there's people who build things that own the IP of that thing, and then there's people who build things on behalf of other people. And these are contract manufacturers, anybody else. Those people's only IP is their ability to build things, right? Like they build other people's stuff. And so particularly for those people, being able to come in and say, we're not going to take all of your thousands of cameras on factory floors and take all that data and train our own model and give it to a competitor, but this is actually your thing that you're collecting that data, you own it on-prem, we help you on pre-training and kind of the other stuff, but eventually it's your strategic advantage inside of kind of a highly regulated, very closed off on-prem environment. This makes large defense primes and others very excited, right? They're bringing something to market themselves in partnership with us to have a strategic advantage. And I think it smells very different than a foundation lab that's just come combine all your data and we'll make something better for everybody.
Maybe we can open up for one question from the audience.
I'm curious about the work that you're doing with digital twins. You talked about privacy, and I'm just thinking as all of us as individuals, our IP, right, is our knowledge and everything that we know. I'm curious as you're working with companies, what is the thinking about that? Is they're helping create digital twins for employees? I see a real benefit for the enterprise, particularly as people leave. And what happens with people's personal IP as a digital twin? Do you guys has that come up?
It does comes up a lot. So let me start by some use cases, for example, right? One of the large CPG companies is building a digital twin of packaging expert. Not many people are going into packaging. So there are only few people and who are retiring. One of the largest insurance companies in the US is building it for actuaries. They know what was done, but they don't know why it was done. So how do they train the next set of folks? One of the construction company, they are building data centers, and their biggest bottleneck is they don't have enough people who understand data center insurance dynamics. So they are building. So it's largely driven right now by how do we scale the experts, either because they're retiring, they're leaving, or they're not able to scale. Now, traditionally, what companies have done is they have taken all the data when an employee leaves, for example, and just dump it into something and given access to others without any control or understanding of the privacy. So in our system, what we are able to do is enable employees to have full control over what data about them gets indexed and fed into the models versus not. So it gives a lot more comfort to the people as well. And actually, other thing is the way we have architected the whole thing is human is always in the loop. See, AI is already getting smart. But by bringing human back into the loop, we are able to help them scale dramatically. One simple example is on the consumer side, right? We have now of therapists or college counselors. See, you need a college counselor at 6 p.m. on a Friday evening when you're worried, right? But you don't have access to that. And what we are seeing on the people side, right? They're like, if I don't build my twin and make myself a lot more accessible and available, I might get replaced even faster than I realize. So by doing this thing, I'm able to scale, deliver more, have a higher quality, and be in line with AI.
Maybe we'll, in the interest of time, wrap up, but maybe just quickly, 30 seconds. What really excites you right now? What's something very interesting that you've seen? Or what keeps you up at night?
Yeah, let's just start by myself. I think that I know Ray mentioned and everyone else talks about all kind of technology changes we have seen over the years, right? But from my vantage point, this is as profound, if not more profound than printing press that happened. I think the world is going through this massive change. First of all, I'm lucky to be alive right now and seeing this change, but everything is changing right now. So how do we drive that change? How do we make each of us accessible is what I'm excited about.
I think the thing that keeps me up at night that made me start a company was watching like the world's best minds build foundation robotics models to fold laundry and clean houses when like the absolute urgent thing is for the West to figure out how to build capacity and be able to build and produce things when we go to conflict or something like that. And so that's very scary to me. And so I'm looking forward to a world where we see physical AI like actually make America like the strongest industrial base in the world again, because we beat the competitor.
Yeah, I think for me, what keeps me up at night is this question of how is AI going to impact unsexy industries like agriculture, right? I mean, that is an age-old industry. And, you know, when I think about AI in agriculture, largely it doesn't exist right now, right? And, you know, people want the next AI model that's going to predict where inputs are going, how farmers are using inputs, right? But the existing data layers that we have are largely imagery based. And that can really only get us so far. And so I look at an unsexy industry like agriculture, and we often look at the biotech space or the healthcare space to see what's happening there. What technology can we borrow from healthcare, from biotech, and bring that to agriculture? So what we're doing as a company is we're essentially copied Tempest AI's model in biopharma, and we're bringing that to agriculture. Yeah.
A couple of things comes to mind. Well, first of all, it's super cool to be building again. I think I spent like 1 billion tokens last month in coding, and it is just so much fun building these things and products and tools. You know, it's sort of becoming a kid again for those who loves to build and so forth. So that's really cool. I'm particularly excited right now for open weights model. I think it's an incredibly important thing for the ecosystem, and you know, that's the only way you can drive the token cost down over time, which is getting closer to the, let's say, the bare metal and you know, infrastructure and so forth. And more importantly, these open weight models allows you to kind of tailor these models however you want it to be. You know, like it bumps me sometimes when I use any of the proprietary models and it has guardrails where it can't answer me some stuff that I'm trying to do. And you know, it is only going to get worse if you don't have open weight models. And so I'm really excited about that. There's some incredible moves that has happened over the last few months. Yeah, I think we just want more of that.
I think the thing that's most exciting and what I've seen over the last couple of years is that because AI tools have become a lot more easy to use and a lot more affordable, we're seeing our clients, our customers in the biotech world actually building their own applications on top of our data sets. And what that does is it accelerates the pace of invention and innovation and discovery. And we're seeing that automation, molecular discovery, and regulatory compliance are all being tied together through these new tools. And all of a sudden, folks who wouldn't dream about getting their hands dirty are now actually building things. And so I think that's been the most eye-opening thing in our industry.
That's great. Thank you so much for speaking, and we're really excited about what you're building, being part of the Tau family. With that, I'll turn it to Amit for the healthcare panel.
Indeed. Can all the healthcare panelists please stand up and come up to the stage? And while that's happening, let me just quick logistics. This is what's standing between you and wine and pizza So you will make your way out. For those of you who don't know this location, go up the stairs and then to your left. There's a whole bunch of signs. There's a beautiful deck. It overlooks Silicon Valley. That's where we'll do the food and the networking. Supposedly, they kick us out at 8 p.m. Historically, a whole bunch of people stick outside. You're allowed to stick outside. You just can't be inside after 8 p.m. So, all righty. Thank you all for being here. I'll pass it to each one of you to give a quick intro. I think those microphones work, right? We have one microphone that's
We'll
not
try it
working.
out. Yep.
Awesome. We'll just go in line here. So,
hey everyone, Andrew Nin, co-founder and CEO of Curafi. We make AI software that helps insurance companies with their workflows.
Christina Lopez, co-founder and CEO of FidoCure, One Health. We're crushing cancer on both sides of the leash.
This one works, right? Hey everybody, my name is Justin Gerald. I'm the Chief Commercial Officer at Teiko. We're ultimately making arguably one of the most important assays or tests that's being used in drug development called cytometry, simple, scalable, and reliable for clinical trials for the first time. Ultimately using this as a foundation to digitize the immune system so that patients, doctors, and just people broadly, anybody who has an immune system can actually take advantage of that knowledge and see how that actually influences their health trajectory and their health outcomes.
Hi all, I'm Mac, co-founder and CEO of Trellis. Trellis help more patients get on therapy faster. So we partner with many of the biggest pharmacies, specialty providers, deploying AI agents to remove any barriers that are delaying patient getting the medication they need.
Hi everyone, my name is Sam Rosenberg. I'm head of finance of Assort Health. We started out with automating with AI call centers for specialty healthcare, but we've moved on to making agents for the entire patient journey.
I'm going to keep this one. You guys can share this one. So I'm going to start actually with a poll here. Do people know how much we spend in healthcare in this country? Shout out, just shout out. Yeah, that's about right. You can say 4.8, 4.9, but who's counting that extra 200, 300 billion? How much of that is paperwork? Just shout out. It depends on how you look at it, but about 1/3 is the consensus. So let me do the math here. About 5 trillion, about 1/3, that comes out to 1.7, 1.8. Who's counting that 100 billion? That is how much money we spend. And if you look at other countries comparable to the US, developed countries, OECD countries, they spend on average 10%. If you go to some of them, they spend 4%. Something is very wrong. Very, very wrong. Like we're spending almost double the amount and we have worse outcomes. And a number of the companies here on this panel are trying to fix this. You look at Assort, schedule a call with your doctor. You look at Mac here, he's trying to make you have access to drugs. Similar way, Andrew. So my question here for maybe the three of you to get started is, how is AI meaningfully helping you with this task, with this monumental task of fixing healthcare?
I can get started. So we have an interesting perspective because we grew from 10,000 patients in one small insurance company to about 18 months ago to now 300,000 patients. And we operate in both very dense metropolitan areas where some doctors are still on paper to rural places where there's a much higher probability of fraud, waste, and abuse, for example. And I think healthcare in the US, I'll actually challenge the notion that we have worse outcomes. I actually think that we have very good outcomes, but we have bad cultural problems in America, like obesity and depression, things like that. I think AI is going to be able to solve that in ways that we actually don't really imagine today. But what we're doing at Curafi is we're digitizing a lot of the fax layer. So healthcare is an industry that still is operated on fax machines. We process probably tens of thousands of authorizations a day. And it's literally doctors' offices. We interact with about 70,000 doctors, so 7% of all NPIs. The workflow now is everybody is sending a fax to the insurance company. The insurance company has an army of people waiting by the fax machine that grabs that fax and then puts that data manually into their internal systems. So there's, as you can imagine, that's kind of like the fundamental problem that we have that's not very scalable. So what we think is, there's obviously a lot of companies within the Tau portfolio too, automating various parts of this, but it sounds like a pretty trivial problem when you dig into it. There's hundreds of little steps, and that just means that there's, as the problems compound, there's many, many billion-dollar companies that can be created even from that sole problem alone. And maybe that's it for.
Yeah, similar to Andrew's perspective, like it's a little bit of a cliche for us, but it's cliche for a reason. Our perspective on how we're improving healthcare is really trying to, even though we're an agentic company, we're trying to add the human element back into patient access and patient engagement. And so what we're really excited about is leading with healthcare that really remembers the patient. For us, that's kind of our proprietary data edge, is delighting patients as they engage with healthcare in a much more proficient manner. So everyone's always, I'm sure folks have lots of experience waiting on long call lines. And so our objective is to eliminate that and make sure patients are efficiently routed to the right care provider at the right time. And also, it has a flip side of providing greater revenue opportunities as well as cost savings opportunities to provider groups.
So I think a lot of it, right, you mentioned a third is going to administration, which is pretty crazy. It's almost like if you talk about this in other industry where the transaction cost is 30% of the actual service being delivered, that it kind of signals that there's like a underlying infrastructure problem, and a lot of things that Andrew mentioned happening on the insurance side is the same on the provider side, where it's different fax machine interoperating really complex set of information. I think where AI, and especially agentic AI, can really significantly reduce that cost down is in the fact that these AI systems are now good enough for some of these tasks to really take 100% of the work and not just assisting with some of these tasks. And then a good example of that is, for example, if you go into these specialty clinics, the last time they buy significant piece of software was in like the 90s or 2000s, which is like the EMR.
1990s?
1990s. Yep. Just like if you look at these EMRs still run on like Windows machine, right? And now we are able to deploy these compute agents that are processing that script, right? Looking at the clinical guidelines, understanding, hey, is this patient, and does the scripts match with what they need, and really dispense that script end to end. And just by doing that, instead of $20 per hour of a technician time, we can do it at like $2 per hour, which is, like a big unlock.
I was half joking and half serious about the 1890s. My wife is a physician, and she got trained 2005. 2005, she used paper. She had to use paper for charting. Not computers, not phones, tablets, stone tablets perhaps. But healthcare, there are reasons healthcare is the way it is. Not all of them are good reasons, but it is an industry that's historically been resistant. But I want to flip the script here. AI is actually getting adopted by healthcare at double the rate of the economy. There's plenty of articles on this, plenty of data on this. You guys can look up more. And one of the areas where there's a lot of promise is around drug discovery. Think about it. Like, we know 0.0001% of all the molecules that are out there. With AI, we can actually predict the structure of proteins and enzymes, and we can actually model it. We don't even need to do thousands and thousands of tests. So I would love to have Christina and Justin speak a little bit more on that, because you guys are tackling one particular type of molecule here, which is for cancer. How do we improve, prevent, avoid, or even cure cancer?
Yeah, thank you. That's a great question. And hearing about faxes in 1990s is really good for the more generalist audience, because if you're a truth seeker and you're really trying to actually decode cancer and target it properly, it's really hard in the current ecosystem. There are a lot of breakthroughs like AlphaFold and all of that, and that's really around the early discovery data, so really mapping basic biology. But most of biology is just really not well mapped, period. And then when you move down the chain, so I'll give a couple points of view. So where we're coming from, I'm actually using what's considered a comparative oncology model, So I actually care for cancer in pet dogs. So dogs and humans share about 86% of the same DNA. There's been a coevolution. So I bypass literally all of this friction. I even bypass HIPAA. And we unlock an economy because the pets are our family, and there's an economic value there to treat and care for them. And the data that we gather, which is longitudinal, and we can actually interrogate many more therapies and just do things that in the human world you'd have to do the faxes in the 1990s and IRBs and all of that are frictions, we can go much faster. So our loop, in order to figure out what's the best target, what's the best drug, and then generate outcomes leveraging like billions of data points, leveraging AI, and then beautifully now going to the regulator, to the FDA, who is truly trying to innovate. I will say, you know, I'm not doing vaccines, so I'm not in that world, but for what we're doing, this administration's actually been very receptive, and that's been kind of cool to learn about.
So I think for us, like immunotherapy, everybody's heard about that. It's kind of one of the biggest breakthroughs that's happened in the last couple of decades in terms of a new way to treat cancer, and you're getting cures and all that. I think at Teiko, you know, one of the things that we're doing is, like I mentioned, we're trying to make it so that this technology called flow cytometry is something that is scalable and is a reliable measurement, but it's only one measurement of the immune system. It's actually, there are many different aspects to the immune system at the protein level, at the cellular level, at the genomic level, at transcriptome level. There's a lot of data sets that are being put together in order to fully understand what is the immune state that actually can lead to a curative outcome in a patient, and which ones actually are not and lead to an adverse event. And so I think what AI has been super helpful with for us, and then ultimately as we were working with all of our other groups that have complementary and orthogonal assays in order to understand this, is actually finally synthesize what's going on. Like, I'm a PhD immunologist by training. I dedicated about 10 more years of my life to understanding this, and people have gone, and we've had customers that come to us and say, hey, this is a great data set you generated, but like, how do I interpret this? And then look at me and I'm like, I am an immunologist. I can start trying to piece these things together, but ultimately I can only do so much. But what's really cool now is that with AI is we can bridge all of this knowledge together. We can bridge the recent publications that have come out, seminal, and all these different indications, all these different treatments, actually try to fairly quickly synthesize all these multimodal data sets to see truly what's happening here, truly what are these temporal changes that need to occur in order for a patient to actually have a positive outcome from this. So I think that's been truly exciting, because now it's not just one person, it's not just one team, it's every team and all their information that we're putting together in order to actually ultimately lead to new discoveries earlier on in drug development and really match up patients with the right treatment that's actually going to make them experience a cure.
About 10 years ago, I wrote an article on sales cycle in healthcare, and I was trying to look for the right picture. I finally found a dragon, and you know, Creative Commons back in the day. Today, I would have used ChatGPT. Anyways, I put a dragon there because the dragon represents the effort you have to do. They breathe fire on you, they kill you. Pilot hell, that's what I called it. 9 to 18 months before you get into a payer. 2 years plus before you get into pharma. If you get lucky, maybe a provider will give you, you know, some kind of one-time revenue within 3 months. That used to be all true. I think things are changing now, because maybe all of you can attest to this. Some of you are actually growing 10x year over year. You're being able to sell into your prospective customers much more quickly. I'm still trying to figure out why and how is that happening. Is that temporary? Is that permanent? Is this a sign that the industry overall is changing permanently, or is just a blip? Would love to hear from any of you.
I think there is a tectonic shift happening like right now, and I think it's here to stay. I think all of us innovators, you know, when we're here in Silicon Valley and oh my God, it's so great. Everyone, you know, we all use the lingo and it's so cool. And then go knock at a door, you know, and you know, pick your poison of incumbent industry. It's really tough. And I think we're, for the first time, it's become that we are like the cool thing that they're actually interested in. I think there's an opportunity and there's a need. Maybe it's from the stock market, I don't know. But I think there is really a clearer path to transact if you know how to press the right buttons, say the right things, and frame it. I'm not sure if everyone's experiencing that.
I think one thing we find really interesting, right, is that sales cycle becomes much shorter. And the reason for that is that the ROI is quite real, right? Like previously, these healthcare providers are used to buying a solution, takes 12 months to go through a procurement, another 12 to 24 months to implement. With agentic AI, integration become much easier because you don't have to rely on API. You can use the computer use model to go into the EMR to do the work. You don't need to do a lot of change management to get people on board with the tool. You're able to just pick up that unit of work and execute it end to end. So these providers who normally expect a really long and painful technology adoption are able to see value in the first few months. And that allow us to really speed up that process and not have to go through the traditional procurement cycle.
Yeah, I would echo that too, just in terms of what we see at Assort Health in terms of sales cycles. It's we make a very easy pitch to folks in terms of crystallizing an ROI, and oftentimes we enshrine it in a contract that we have to hit a certain ROI, or else the contract has an opt-out. But for us too, I think that we've noticed that, again, cliche software eating the world, but we found that folks, especially with the agentic front door, it's been sort of an abandoned area to invest in compared to, say, like systems of records with EMRs, where you have much longer product development cycles, things are much more stable. We view ourselves as a system of action. And so for the first time ever, folks are kind of thinking about both, like I said, the cost and revenue side of what agentic AI can bring to provider groups. And then finally, last comment I would say is just, we benefit a lot, we think, in terms of our sales strategies from leveraging PE relationships in MSOs, where it's much faster for us to kind of spread across many different locations.
Obviously agree with what most of the panel is saying. I think with healthcare, the bar for adoption is just very high historically. So a lot of companies were pitching the same thing, but never really cleared that hurdle. But LMs now are so good. And the rate of kind of that Cold War among the AI labs has made the products so much better. And I think also with healthcare, and like a lot of enterprises, you have kind of like a fat-headed long tail of some very large providers and payers, and biopharma as well, and a very long tail of other companies. And as everyone mentioned, the ROI is to the point now where that long tail is now moving a lot faster than waiting for that fat head to make a decision first. I'll say that the industry has evolved to where there's more tactical business models that we can adopt. So for example, with selling health insurance companies, you can do things like a risk carve out, where basically you're accountable to some amount of risk. You can kind of play around with that contract. And basically if it's, there's a spread there that the CFO sees, you can make the sale tactically a lot faster because AI is giving you that ROI. So there's now these different business models I think can exist with LMs that we didn't really see in the last 10 years.
I think ultimately AI has really just helped to understand the customer better. Every time that we go talk with them, we're recording it, we're figuring out what are their questions, what are they asking, and it's just really much more easy to remember customer problem first. Do we have the solution? Matching it up and making sure what we are selling is exactly what they're looking for. And if it's not there, we're moving on. If it's not there, we're building for it. So I think in a very simple form, it's just been able to allow us to integrate all of what we're taking in order to match up and make sure what we are building is exactly for what the customer is asking.
So,
I think there's something else that has to change. I don't have an answer for it, but has to change in the kind of investment economic model for tech in the medical industry and the healthcare industry. So if you go back and look at decades and decades of investing by venture capitalists, and compare, and most venture capitalists have two arms. They have typically a medical and, healthcare investment arm and a enterprise tech. You compare the returns, enterprise tech just blows it away, just not even close. But now we have this opportunity with AI that if you just measure it based on pure, virgin problem to solve, like I think you said, or one of you said, the biggest problem on the planet, U.S. healthcare system, biggest opportunity for venture capital. I would put 90% of venture capital available today into healthcare, into digital healthcare. The problem is that you pay fairly high prices in the seed and A rounds, and you get private equity returns. And private equity is where a lot of companies end up in, and that needs to change. That there has to be, and a lot of capital sits on the sideline because they said they haven't figured this out of how to get the returns, 20x kind of returns out of healthcare that they get in enterprise IT.
90%. You just gave me a job for a while. I'm putting you in front of all my potential LPs. Actually, on that note, I had a conversation recently with a potential LP, and it went basically the following. Oh, you guys do a lot of healthcare. That's great. Yes, it is. Look at our returns. They're great, blah, blah, blah. Why aren't other VCs doing it? Well, beats me. They don't understand the business of healthcare. They're afraid of the seed stage. They think there's too much regulation in hardware, which, by the way, we don't do. And you need to have expertise and experience. Okay, that kind of makes sense. Where are the exits? I said, well, there's a bunch of exits. You look, Livongo, 39 billion. Look at Tempus, Transparent, et cetera. All these companies, not all of them have exited, but they're in the $100 billion range. Where's the $1 trillion? Well, it's here. I just don't know about it yet. We'll find out. So that's my question, actually. What do we need to do as a society, as startup founders, as investors, et cetera, for the next Google, for the next Amazon, for the next $1 trillion plus company to be a healthcare company?
So, I mean, again, I'm coming back from this basic biology point of view, right? Of, for example, Anthropic and ChatGPT and OpenAI, they can only give you really an insight from what's on the cloud. So the mapping, the decoding, which you're doing in the immunological side, the decoding, again, the mapping, the measurement world in biology really needs to blossom at a whole next level. And I think it is. So that then you can have that effect that we have, that aha moment that you have from, ChatGPT, that's leveraging all that information that exists on the cloud. The biological world, whether it's from actually health, but could also be in the environment, is really not understood. It is really not mapped. Like, we really don't know very much, like maybe a touch of the immunological system. So I think mapping and decoding, once we're across that part, I think that's going to explode. And then on the other hand, we can still have more drugs, but if the regulator and those processes of clinical trials and whatnot still stay very stagnant and very friction heavy, so that's a huge opportunity. So imagine a world in which we map biology in our systems in a whole next level way. We can figure out better targets. We can figure out better drugs. And then we're able to push them through still with, with rigor. We don't, not everything needs to break, and go fast, but much faster than now, where you have a regulator that's maybe clinical trials that are highly distributed and happening all over the world. So every patient, every time you go see the doctor, maybe in all your devices, everything is getting integrated. So I think that's the aha. And I think it's actually kind of doable.
Can add a little bit more to that one too, because I think it's actually a pretty good addition. I think one of the big things is, like, rather than creating drugs for average, is creating drugs for the individual. And I know we've been talking about that, like personalized medicine, for a long time, but now that AI is here, I think it is very possible, where you can take all of that information that we're gathering from a person. And I don't know what the actual things that you need to actually gather in order to get those ingredients, in order to make and improve that sort of like drug development cycle to make it so short, so fast, so quick for an individual that there is a drug specifically for you because you are a unique snowflake, unique N of one, that a lot of these drugs we're just hoping that it works well enough for most people, or in some cases, at least 20% of them. And I can imagine with bridging all of these data together and improving that cycle and trying to create for the individual and curing quickly, that could be a pretty huge thing in healthcare.
So one thing I'll add is I think we do have the first $1 trillion companies in healthcare. I think Eli, someone correct me if I'm wrong, but I think Eli Lilly is a $1 trillion company, and there's well, the GOPs only came out in 2018. So, but on that note, seriously though, I think there's something that clicked in the public cultural consciousness in the last 3-ish years with the adoption of GOPs and now peptides, which scientifically are a bit of a meme, but nevertheless, there's some consumer adoption of this that I think we are greatly underestimating where in the healthcare system that's really going to impact. So there's some bridge between the current kind of like healthcare service delivery, people are getting sick and now we have to treat them, that complex versus the consumer health peptide complex. There's going to be something there that it is something that we think about in our company all the time, but we don't have any great answers today. But that is an area that we're looking at very, very carefully.
And quick thing here is, as you mentioned, right, healthcare spend is $5 trillion. Historically, software companies are not able to either influence or impact any of those spend. I think that's changing as we see more and more healthcare payers, providers looking at AI and software as replacing some of that labor budget. So if we're able to deploy these solutions that really take away at these labor budget of human transacting with each other to get patient to care, I think that's where you really substantially expand the TAM. So I think that's the first piece. The second piece is on the medication spend and pharma spend, where if you're able to better match patient to the right therapies, or actually make sure that patient, for Trellis, for example, only about half the patient that get prescription end up getting on therapies. So, the other half, that's about like $1 trillion in spend. So if we're able to do those things more effectively, more efficiently at a broader scale, I think that's where we get to $1 trillion.
I don't have a ton of other original thoughts to add to the conversation, aside from when I think about businesses that take off, and a lot of it has to do with distribution power and just ease of distribution. And so that's why software is one of those areas, that people think about. And so I do think somewhere kind of like what Andrew was saying, with consumer diagnostics, or, something with precision medicine, like I think that's probably where we'll see the next $1 trillion company in healthcare.
On that note, this is a wrap. Wanted to thank you all for being here, outside and up. Thank you so much to our panelists. I said it 3 or 4 times.
Oh, you already did that? Okay, great. It's up there, upstairs. Great job.
Great job.
Oh, it's all the pizza. So, but I know they're gonna kick us out at 8.
Yep. No, I agree with you. We went slightly over today.
Yeah, it's okay. Hey, Maji, how you doing?
Yes.
Yeah, thank you always for being a supporter, our champion. Hopefully this was fun. Now you're one of our venture partners. So
Thanks for coming.
thank you for being here.
Good.
Yeah.
Connect more inside the people.
Yes, of course.
Oh, no. Sounds good. I live in a little bar. Thank you for coming.
Like an additional, you have side letter or something?
I'll say no to that, Rich. Oh, was he here? Share some of mine. Just send me the deck.
Oh, yeah. No, we're good.
Good you. Wonderful event. Well, thank you. Fun three. No, now it's up and running. But the way this works is you have to go. It's a long time. This is what I'm saying. I think one of the questions was about what does they say? I think information physics is not what you started on, however, it's actually much more. Yeah, just think I have my pictures.